I'm Dr. Jacqueline Ish. Well, today I'm going to talk a little bit about dry skin and what you can do to prevent dry skin and what the treatment is. The skin is a natural barrier to protect your inside organs, and the skin produces its own moistures and oils, and so it's important not to do anything to help strip these oils or to take away the natural barrier from the skin. For example, people take long hot showers, and actually to prevent dry skin, what you want to do is take a warmer, cooler shower and not bathe for more than 5 or 10 minutes. If you take a long hot shower, you're actually destroying the moisture in your skin, and it will certainly dry your skin out more. So after you take a shorter, warmer shower, first thing you want to do is pat dry. You don't want to take a towel and rub your skin or scrub it. That's going to irritate it, cause redness. So immediately after a shower, what you would do is pat your skin dry gently and then immediately put a moisturizer on. Once you take a shower, that kind of strips the moisture, and by putting a moisturizer on immediately, it will help maintain that moisture in the skin and kind of trap it in there. Best it's to use a unscented moisturizing lotion. When people have really dry skin, sometimes they need to put that lotion on a couple times a day. For example, in the morning, right after you shower, and then some people apply another layer before they go to bed at night. If you tend to have really dry or chapped hands, then sometimes you would want to put lotion on. Every time you wash your hands, you'd immediately want to dry them and put lotion on again to help keep them moisturized. So the key is really prevention to prevent the dry skin. But once your skin is dry, then the treatment is basically a lotion or moisturizer. Now these are found in the store and are available there. Sometimes a lotion-based moisturizer isn't quite enough. Sometimes people need more of an ointment or a greasier, thicker lotion for the dry skin. Your options might be limited here. At home, people will use Vaseline or like a Eucerin or Aquaphor, which is a greasier ointment type of lotion. The cheapest thing at home, actually, people will go buy Crisco shortening. It's a lot cheaper than an expensive ointment or cream. Of course, once again here, you want to use the lotions that are available. I've had patients tell me they purchase the hair grease from the store because it's a little bit thicker. I've had patients tell me they use the butter off their trays. I'm not saying these are things you should do, but anything that can trap the moisture in and help kind of grease up the skin to prevent dryness would work well. They also have steroid cream, like a cortisone 10 or an over-the-counter hydrocortisone cream. You want to be careful with steroid cream as it can have potential side effects. The best thing is to moisturize the skin to prevent the severe dryness and being chapped. What is the steroid cream good for? If you have extremely dry and scaly skin, steroid cream might help. But if you use a steroid, you only want to use it once or twice a day. If you use it for a couple days or up to 14 days total. If you use steroids inappropriately or for too long, it will actually can cause an over dryness of the skin. It can cause burning, redness, itching of the skin, and long-term use can cause thinning of the skin or hypopigmentation, meaning the color or the pigment of your skin might wear off and leave you with lighter spots. Sometimes with eczema flare-ups, people will use a steroid cream for the thick, rough, scaly spots on their skin. Otherwise, just for itching alone, the best thing is to avoid heat. You will itch more if you get hot, if you take a hot shower. If you exercise and sweat a lot, that will also cause excessive dryness or will dry you out. They do have loratadine or Claritin, which is an antihistamine or anti-itch medication in the store as well to help with itching or dry skin. But you really want to moisturize to prevent the itching. You don't want to scratch. If you scratch, it actually makes you itch more, will cause more dryness. Scratching can cause a breakdown in the skin, which can actually lead to a bacterial viral infection in the skin. And so you want to avoid scratching the skin, which will make it itch more. The heat, people will itch more at night because at night our bodies get warmer. We will itch more at night or when we're hot. Eczema is a specific skin disorder that is not very common in adults. Eczema is kind of a chronic condition. They don't know the cause of eczema. It's thought to be part of a genetic predisposition or environmental factors that cause eczema. It's common in kids and children. Most people with eczema will outgrow the condition by age 10. Only about 3% of adults actually have eczema. A lot of other people have dry skin, but eczema itself is not too common. Eczema is a chronic condition, meaning it will come and go throughout your lifetime if you have eczema. One of the triggers to eczema will be stress. And so people come here thinking their blankets or their laundry detergent or something is causing the trigger. Typically, just being here can be a stress, which can cause a trigger the eczema. What you want to do with eczema is moisturize to prevent the rough, scaly skin. Use the steroid cream kind of only as necessary, but you just have to know that if you have eczema, it's going to come and go, and that's a normal variant. Psoriasis is also a little bit different. It's a rare condition that people have more silvery plaques, and the treatment is prevention, moisturizing, and a little bit of steroid cream. So when would you need to contact medical regarding your skin? As far as dry skin, we don't really have a medical treatment. Medically for dry skin, it's just about education and prevention, avoiding the heat, using a good moisturizer to prevent dry skin. Medical doesn't have anything magical that we can give you for dry skin, other than advising you to get some lotions from the store and use it appropriately. If you have if you're diabetic and you have foot ulcers or infections or problems, therefore it might be beneficial for medical to take a look at you. With rashes, once again, you don't want to scratch. Most rashes can be caused from dryness or something irritates you. If you use a certain soap and it irritates you, stop using it type of thing. There's not necessarily medications or treatments for dry skin or rashes. Once again, the antihistamines or loratadine is a anti-itch medication, lotions, a little bit of steroid cream. But if anything is looking, red and hot and infected or draining pus, things like that would be times you would want to let medical know. We could take a look at it. Not all rashes or redness or infections, so don't expect that everything you're going to need an antibiotic or you need something specific for. A lot of times we can take a look at it, advise you what to do, give you some education on it, but you won't necessarily need pills or creams or anything for that, but we're happy to take a look if you're having skin issues. I'm Dr. Jacqueline Esch.